Hi, my name is Natasha Tracy, and this is Bipolar Burble. Today I want to talk about stigma and anti-stigma campaigns, specifically as they relate to getting people access to mental health treatment. So there are anti-stigma campaigns everywhere. You just turn around and someone's screaming, "Stop the stigma." I get that. And no one wants there to be stigma around mental illness, least of all me. I have bipolar disorder, and yeah, getting rid of the negative connotations that particular illness brings with it would be super. But let's be clear about something. Stigma is not what stops people from getting help for their mental illness. Research bears this out. According to research, the reasons that people don't have access to mental health treatment are because a lack of access and the fact that it's too expensive. They don't have the money for it. Those are the reasons people aren't getting help for mental illness, the top two. Stigma plays a role in how we look at mental illness. That's totally true. But it's not why people aren't getting help. And when activists frame it in such a way that by stopping stigma, we're somehow helping people get the treatment that they need for mental illness, that is incredibly disingenuous and pretty much a lie. That's not what the research says. Yes, stigma affects people, and there is a small number of people for whom that does affect their ability to get help. I'm not denying that. But what I'm saying is it's not the predominant factors. The predominant factors have to do with people with mental illness not having good health insurance, not having access to medical care. Those are the things that actually are keeping people from getting treatment. It's not this fluffy, squishy stigma concept. That's not it. So when you see an anti-stigma campaign, consider this. Anti-stigma campaigns are easy to fund. They're easy to sell. And everybody understands what stigma is, and everyone understands that it's bad. Okay, I get that. But that's not where we need the help. That's not where we need the funds. That's not where we need activists to be. Activists need to be in places that encourage people to get treatment and help them actually gain access to the treatment that they need. We need people who engage with politicians. We need people who engage with corporations who control the health coverage. We need people who engage with people who are experiencing homelessness. Those are the people who can actually affect the rate at which people with mental illness are getting treated. So remember, there's nothing wrong with being anti-stigma. There's nothing wrong with an anti-stigma campaign. But don't fool yourself into thinking that that's the major issue around mental illness treatment. It's not. My name is Natasha Tracy, and this is Bipolar Burble.